Good morning, everybody. Lovely to be here this morning and to share a little bit my thoughts on the global power of oncology nursing during this auspicious occasion of the London Global Cancer Week. My name is Judy Khanyola and I'm an RN, and I'm the chair for the Center for Nursing and Midwifery at the University of Global Health Equity in Rwanda. What would happen if nurses were the ones in charge? And here I don't mean in charge of the ward or the unit, but if they were in charge of the state, the county, the district, the provincial, the country health services. If they were in charge of national healthcare policy, dare I say, in charge of the National Health Service here in the UK that you have. This week is dedicated to the Universal Health Coverage, or UHC. And this is a picture of the Universal Health Coverage Forum about 3 years ago in 2017 that was held in Tokyo, Japan. Now, I want to say in this room full of men that I'm looking at, I don't think there is any nurse. These two pictures depict two differing scenes in Africa. On the left-hand side, we have a picture of the Aga Khan Hospital ICU in Nairobi, and I worked there for many years. And on the left-hand side, you have a picture of the largest hospital in Juba, South Sudan, and this is the malaria ward. The Aga Khan Hospital in Nairobi ICU is only the province of the very rich. Many Kenyans cannot afford it. And even when they do, the financial outlay that they have to put out often impoverishes them. The one on the right, the Juba Hospital, it depicts just a typical government hospital in many parts of Africa, where the services that you get lack staff, lack resources, lack space. And so the services that you get are just the bare bones minimum, often non-existent. For me, often I say universal health coverage in Africa is an illusion. A cure for cancer. We're celebrating, the week. London is celebrating the Global Cancer Week. And I do not propose a cure for cancer, but I propose a cure for the suffering caused when the power of nurses is not recognized, and more than just recognition, when the power of nurses is not fully utilized. Meet Flora. Flora is an oncology nurse at the Aga Khan University Hospital in Nairobi that I just mentioned a short while ago. And Flora, just like many of us oncology nurses, does a lot of things. Cancer is a leading cause of death and debilitation globally. According to the Journal of Cancer Policy, cancer is the leading cause of mortality in Kenya, accounting for 7% of annual deaths. A Nation Newsplex review of 2015 of health data showed that the rate of death from cancer in Kenya is outpacing population growth and may double by 2026, just a few short years away. This is the challenge that Flora is faced with, and which through her oncology nursing specialization, she manages daily, bringing comfort, respite, retreat, and remission. Nurses, and especially oncology nurses, don't just administer cancer treatment modalities, but nurture the whole patient, including the family, significant others, and the community. The power of nursing in general and oncology nursing in particular is evident throughout the cancer continuum, from health promotion, risk assessment, care for people receiving cancer treatment, through to end-of-life care and even after onto survivorship. And it is this winning combination of, first of all, seeing a human being and then treating that human being with, all our medical scientific weapons, that is the true essence of nursing. We celebrate this year Florence Nightingale. This year has been dedicated by WHO to, her bicentennial. And this is the power of nursing. Oncology nursing throughout the world does the following: prevention. 1/3 of cancer diagnosis, as I know many of you know, can be avoided by reducing risk factors. Some of these are like tobacco use, improving our diets, our activity levels, lowering alcohol consumption, immunizations, etc. Nurses do this exceptionally and exceedingly well, and they do it both at the individual and the community level. A school based opt out HPV vaccination program in Rwanda, utilizing nurses, reduced the 2-decade delay in vaccine introduction and between high income countries and low and middle income countries to 5 years. This was done by nurses. Nurses screen, do early detection. Nurses treat, they're involved in treatment modalities, supportive care. Nurses are now often doing research and are involved in evidence based practice. They are in palliative care and hospice, advocating for end of life care, and even post into survivorship, post treatment follow up care, psychosocial support, and healthy lifestyle promotion. What are some of the milestones that oncology nursing has had in Africa in the last couple of decades? Before 1990s, major cancer treatment was just surgery, and nursing care was mainly divided into post-op care for op cancers and those that required end-of-life care for inoperative cancers. The role of the nurse was often just limited to inpatient care of hospitalized patients. In the mid 1990s, this shifted a little bit, and nurses were involved in direct inpatient care. Things moved away from the hospitals to homes to hospices. We started educating patients more and more, and were often involved in research, but mainly as coordinators. In Africa, this change came as about the exacerbation that was brought out of chronic disease by HIV, which exacerbated many of underlying cancers, increased the cancers. HIV itself at the end of life has a lot of cancers as well. And so because of this, the shift moved gradually away from just managing post-op patients in hospitals to home care, community care, hospice care. In the late 1990s to 2000s, then we saw the era of the highly specialized nurse. This has continued up to now, where nurses now are involved in routine IV chemotherapy, linear accelerator for radiation therapy, and this moved into the 2000s. After 2010, we now more and more, even here in Africa, have expanded nursing roles where they're involved in quality QI, clinical researcher roles, specific cancer diagnosis. These days we have hematology nurses, we have breast care nurse, we have palliative nurses, oncology nurse consultants, and so on and so forth. And this is just briefly showing you the trajectory that oncology nursing has moved to where it is now. What are people saying then about us nurses? What we have achieved together is impressive, but what we are yet to achieve is vastly more important. We must use the national, regional, and global data and the International Year of the Nurse that I talked about earlier and midwife to foster closer dialogue and collaboration between all sectors on strengthening the workforce to better provide primary care and progress towards universal health coverage. We must catalyze and sustain investments in nursing education, jobs, and leadership. The health of the world requires the commitment of all countries to support and invest in the nursing workforce. I pulled this out straight from the State of the World Nursing Report that came out in April 2020. And these are the words of James Campbell, the Director of Health Workforce Development at the World Health Organization, Howard Catton, our Chief Executive at the International Council of Nurses, ICN, and Mary Watkins, who's the alternate co-chair for Nursing Now. Maya Angelou says, as a nurse, we have the opportunity to heal the mind, soul, heart, and body of our patients. They may forget your name, but they will never forget how you made them feel. Are you a nurse? Don't forget the power you have to daily make someone feel better. Do you know a nurse? Don't forget to say thank you. The future of UHC and its success depends on a strong health workforce. and a strong health workforce depends on nurses, and that is our power. Thank you very much for listening to me.